As Omicron continues its spread, as we've been discussing, children under the age of 5 are still ineligible for vaccinations, leaving many families in limbo, wondering how best to navigate everyday life. Stephanie Sy has a conversation in a moment about some of these important questions. But let's begin with what we've heard from some parents across the country and how they're coping nearly 2 years into the pandemic.
My name is Lori Sipe Chen, and I live in Oakland, California. I'm a mother of a 3.5-year-old, and we are expecting our second child in about 3 weeks.
My name is Tim Sukram. I live in Chapel Hill, North Carolina, and I have two kids, ages 4 and 6.
My name is Meg Trelease. I live in Philadelphia, Pennsylvania, and I have two children. I have a 4-year-old girl named Saoirse. My son Beckett is 2, and he has Down syndrome. He is awaiting a heart procedure. He is immunocompromised.
My name is Detricia Taylor. We live in Clarksville, Tennessee. Having a 4-year-old who's not vaccinated when the rest of the house is vaccinated, it's been a little hard as far as traveling and even having people come into the home.
Right now, with the surge, we're continuing to send our child to childcare because we need that help. We both work full time. We're getting ready for a baby, and so I keep saying it's trade-offs of life decisions on a week by week basis.
He's 4 years old. He's already gotten COVID at daycare, even if they and he's been wearing masks as long as he's been back at school. And it seems crazy that he might get it again. Day to day, you kind of just have to fool yourself and say that your kid's not going to be the one that goes to the hospital. Your kid's not going to be the one that gets complications. And I don't know that for sure.
We have family that love us and friends that love us and want to see our kids, but it's like, well, what if we wore a mask? Well, what if we tested? What if we? And I go into these conversations knowing that ultimately I'm going to have to say no, but I enter into them because I don't want to be that person. So we're just literally in our house, and we've been in our house for 2 years, and I feel so beaten down.
It is scary because she continues just, a little cold. You're kind of like, oh my goodness, is that what that is? Is it that new variant, or she's running fever for no reason? Is it the new? It's like you're constantly wondering everything that's happening to her. Could it be that new variant? And if it is, how bad is it going to get for her? Will she have to be hospitalized?
It's really like, what are the risks to my unvaccinated 3.5-year-old? But also, like, are there additional risks to an infant? Like, is there a difference between an infant and like a child, even though they're under 5 and not vaccinated, if there's, some other additional risks that we're taking on? Our 3.5-year-old goes to preschool right now, and they have, safe practices, but it's hard for me to quantify the amount of risk that we're taking on.
My big question is, how is it taking so long for kids under 5 to get approved for a vaccine? Why aren't they more of a priority? It's bad for us parents. We're really worried about our kids' health, but they're worried too.
The public health information has been so confusing. I do wish I had a little bit more information on community spread, because right now Philadelphia is hovering at about 40% positivity rate. When is it safe for me to send my unvaccinated 4-year-old back to preschool so that she doesn't bring home COVID and infect my son or herself?
I was able to finally get my 6-year-old vaccinated. So it's like we're getting there, but we're just waiting for her so we can see family members more often and travel more. We're hoping that something comes down, maybe the age of Laura, even before that time frame. That's what we're looking forward to. We're left in the dark, kind of.
All right, let's try to address some of the concerns of these parents. And for that, I'm joined by Dr. Ibukun Kalu. She's a pediatric infectious disease doctor at Duke University Hospital. And Dr. Ibukun Kalu, I should say I have my own 3-year-old toddler, so I can relate to some of the anxiety we just heard from those parents. We know Omicron is more contagious. For most vaccinated people, it's more mild. So the key question, I think, for a lot of us parents is, how big of a risk is there of serious illness in our unvaccinated children under 5?
Thank you so much for having me, Stephanie. I hear the frustration, and pediatricians and providers around the country have felt the same as we're trying to tackle how best to keep kids safe, particularly those that are not yet eligible for a vaccine. So, to your question as to how severe this is, we've seen more cases in the community, which has meant more kids ending up in the hospital. But we're also seeing milder infections even in kids. So, what that means is we're seeing upper respiratory infections. But for our youngest kids, the infants, even a simple upper respiratory infection could affect their ability to feed, taking milk, for example, or just maintain their typical health status. And so they need a little bit of support for their breathing or for hydration. So that has meant a few more infants in the hospital with COVID.
I'm glad you answered that question about infant because a parent asked specifically about that. I also want to ask you about immunocompromised children. We heard one parent who has a 2-year-old in that situation. How much more dangerous is COVID to that child? And should they avoid sending their children to daycare?
Those questions are so difficult because it really depends on that family situation. You may need to send a child to daycare just to be able to get to work, to be able to manage the household. So ultimately, it depends on if you have options where you can remove a child from daycare or put them in daycare. As much as you can, ensure the daycare setting is safe. So all the eligible adults that are present should be vaccinated and hopefully should get a booster. And particularly for our immunocompromised patients and our youngest immunocompromised patients, I think a lot of people have aimed for protective bubbles. So smaller daycares, fully vaccinated adults, eligible people that are there, masking if at all possible, and ensuring you're preventing other respiratory viruses such as influenza, which has a safe and effective vaccine at this time.
I want to go back to vaccines in a second, but you talked about protocol safety things that schools and preschools can do for this age group. Is it appropriate to be testing kids this young regularly? Should they be all wearing kid-size N95 masks?
It depends. I think I keep coming back to that answer. I don't necessarily think a kid-sized N95 mask is necessary for all our kids. What I think is a properly fitted mask that can stay on that child's face for as long as they'll tolerate it should be the goal. So if you have a mask that has a proper filter, if you have masks that have ties you can tie around the child's head when they go into daycare, I think those are safe and effective. If you have a mask for a child that has N95 properties and the child will keep it on, then it's fine to use it. As to the other question about testing, if they have symptoms, it's good to get a COVID test and maybe even some other testing based on their symptoms. Talk to your provider as soon as you can if you're worried about COVID or other illnesses.
I just want to follow up on that because a lot of parents I've heard from whose young children under 5 have had positive COVID tests have basically reported symptoms of a cold. If your child starts to exhibit symptoms of a cold, should you get them tested?
Yes, based on our current community rates, it would make sense to at the very least get a test for COVID-19. The chances are high that the common cold could be the presenting symptom for COVID. If you don't have access to a test, and I really hope we get past the point where if you want to get tested, you have to stay in long lines to get tested, you could stay home and monitor the child and communicate the symptoms that are going on with your provider until you can get a test done.
Do you think it should be a priority, Dr. Kalu, of the federal government right now to make the vaccine available to children under 5? We heard from that one dad who thought that would be a good idea. And do we have data on its safety and efficacy at this point?
We're waiting for more data on the clinical trials that have occurred in children less than 5. I think what we know has been based on some media reports and what the companies that are working on this vaccines have provided to us publicly. We know that they're working on it. We know that they had to go back and run this trial for longer, possibly including an additional dose to ensure that whatever that final product is, it actually does what we need it to do, which is protect our youngest kids and help them mount a protective level of antibodies. I don't know the timeline. I certainly think this should be a priority for everybody, and it is a priority for everyone, but I want to also ensure that it's done safely and effectively, and that's what we're all waiting for.
Dr. Ibukun Kalu with the Duke University Hospital, thank you so much for joining us with your advice.
Thank you for your time.